Before the surgery, anesthetic drops are applied to numb the eye. The surgery begins with the patient entering the laser room and being put in a relaxed position on the surgical bed. The laser system is quite large and includes both a microscope and a computer screen. The surgeon will adjust the laser bed so the patient's eye is positioned directly underneath the laser. The surgeon will then use a special device to keep the eye from closing during the procedure. The doctor then begins the surgical procedure by placing a suction device on the eye. The device will block the patient's vision momentarily. The purpose of this suction device is to make the cornea firm enough for the surgeon to create the flap. At this time, a slight squeezing sensation can be felt, which may cause the patient minor discomfort. Once the suction device is in place, the surgeon will attach a very sophisticated tool called a microkeratome. The microkeratome is the instrument used to actually create the corneal flap. This flap will allow the surgeon access to the underlying corneal tissue. Once the corneal flap is made, the surgeon will use a special instrument to gently fold back the flap so that the laser beam can gently reshape the cornea. With the laser positioned over the eye, the patient will be asked to stare at a fuzzy red light. At this point, the surgeon is ready to start the laser process. A sophisticated computer program controls the amount of laser pulses based on preliminary measurements taken by the patient's eye doctor during the preoperative examination. This portion of the surgery only lasts a few minutes. Is then used to remove tissue from the central portion of the cornea. This flattens the central corneal curve. Following exposure to the laser beam and correction of the refractive error, the surgeon will fold back the flap to its normal position on the cornea. Once in place, the surgeon will irrigate the eye and use a special medical sponge to smooth out any bubbles or wrinkles under the flap.